privilege, leaving medical school in Ibadan to do my housemanship in a mission hospital in Edo State then. And I then did my youth service in another mission hospital in Plateau State. And during the in-between time, I volunteered to go and work in Kano Eye Hospital. Just, experience. So my first 2 years out of medical school, I had been to 3 different mission hospitals. What did they have in common? They were run by foreigners, all of them. The second thing they had in common was that they gave a lot of good care. Most mission hospitals gave a lot of good care. The doctors were very dedicated. About 2 years, now this was 85, so like 88, one of the missionaries left and went back to the US, and then they started bringing teams of doctors to Nigeria, Liberia, Gambia, and because we're in touch, he will invite me to come along with him to these places, and I used to go. And it was a very interesting experience because I'll go there and I'll be the only black doctor. And you have all these missionaries coming to help people in Africa. And I said to myself, this is not a good model. So one day I said to him, I'd like to start an organization that will encourage African healthcare professionals to do exactly what you're doing. And he said to me, Iko, I was a missionary in your country. I've been a missionary since 1960 in Nigeria. You are wasting your time. It will not work. And I said, why? He said, no, because, and he didn't say it disparaging. He just said to me, blacks don't volunteer. I said, really? And so when we started Pro Health 24 years ago, it was under those kind of auspices. But I'm glad to stand here today to say that in 24 years, we've been to 23 African countries. In 24 years, we've been to 24 states in Nigeria, all run by doctors, nurses, pharmacists who have volunteered their time, most of them Nigerians. So what I bring to the table is to continue to challenge African healthcare professionals that the missionaries did their best, but it's time that we started helping ourselves. So Africans must help Africans. And the picture that CNN does it all the time. If there's an outbreak of anything in Africa, the first group you see are not Africans, true or false? Okay, that has to change. And it has to change when all of us decide that we can give some of our time. I'm not saying all the time, And from a Christian perspective, I said everybody can tithe. Tithe is 10%. I said, doctor, why don't you give 10% of your time? I'm sure the Muslims have a similar concept of giving to the poor. Use 10% of your time to help someone that will never be able to pay you. Well, it will never give you back. And I can stand here to also say that some of the most fulfilling things I've ever done with my life is to go to a village, nobody, and help somebody. And I remember, I can tell stories all day, but let me tell one or two. We went to one village, we did surgery, bilateral cataract on a woman, old woman. And the next day, of course, you remove the patches and she sees. And then she started saying, she started doing this. Come, bring them. And so as a doctor, you're kind of confused. Bring what? Bring them. What do you think she was asking for? Her grandchildren. She had never seen her grandchildren. So a simple surgery allowed a woman that would have died without seeing her grandchildren to see her grandchildren. Free of charge. You see? So it can be done. And I guess that's all I'm standing here to say. I love what my colleagues have said. You talked about primary health care. You go to villages and you ask yourself questions that sometimes you don't have answers to. Benue State Prof, we went to do a medical mission once, and we had read it in the textbooks, so you taught us. A man came to the hospital with a wheelbarrow. So you're wondering why this man pushing a wheelbarrow. You understand? He was wearing an abada, all right? He came to see the doctor. He removes the wheelbarrow. What is it? The hernia was so huge that he could not physically carry it. He had to use a wheelbarrow to carry it. you won't see these ones in the teaching hospitals. They are in the villages. So I guess my own small idea is simply all of us can make a difference, one patient at a time. Mother Teresa, why are you doing this? Why are you going to Bangladesh to help poor people? They say it's like a drop in the ocean. She says, yes, it's a drop in the ocean. But without this one drop, the ocean will not be the same. And that's my challenge to all of us. Let's put in our own one drop.